Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. On Tuesday, May 13th, the House Energy and Commerce Committee met for reconciliation markup of a bill that includes cuts to Medicaid. 26 hours later, the committee adjourned with a 30-24 vote to move forward this bill. The two major focuses of savings in the bill are work requirements and provider tax. Medicaid enrollees will be required to submit paperwork documenting qualifying activities such as a job search, community engagement, if the enrollees are unemployed. These requirements, though, will not go into effect until January 1st of 2029. The more concerning piece of the bill is the restrictions on provider tax. Although states will not know their options until the details of the bills are further clarified, what we do know is that limiting generally redistributive taxes, like provider taxes, will have a detrimental impact on rural hospitals because services are not sustainable without this kind of funding. We're going to forego our regular news format to bring you another story from our community. This is Katie Huff, a Hillsdale County resident and employee of Hillsdale Hospital. She has a powerful story about how Medicaid helped her feed her son.
My son Connor was born August of 2020. I was a new mom and a new single mom all at the same time. And we were breastfeeding and we were doing the things, but Connor just was not. He was violently vomiting after every feed. I think I spent more of my maternity leave covered than I did not. So I did everything. I changed my diet. I switched to non-dairy milk products. I took things that were tomato-based out of my diet. I did the most random Google TikTok mom things you could find, and none of it was working. So his pediatrician and I decided to switch him to a formula. Started out with the sensitives kind, the soy-based kind. It was all the same. He was still just actively not getting anything out of his feeds. So after we tried all of those basic ones, we switched him to a hypoallergenic formula called Nutramigen. His pediatrician, she sent me home with a couple sample cans that they had in office. And it was the first time that he was able to eat a bottle without losing any of it. He was able to keep it down. He was able to stay happy, and he was able to be fed. And it was kind of like we've gone through everything else and we saved that for last because we knew how expensive it was. It is the most expensive formula on the market. $20.25 and one can costs $42. So, and that was about the same price it was back in 2020. Single mom, working full time. That wasn't happening. So I did some research and I knew I could try to get WIC, but I knew working full time, and having a company that offered insurance, I wasn't going to qualify for Medicaid, but I knew Connor could. So I had help with our Medicaid specialist, who was Kim Wonders at the time. Wonderful woman. Between her and DHS, we were able to get Connor set up for Medicaid, and then I was able to qualify for WIC, and then he was covered. I was able to get different kinds of the formula that I needed for him. It was a weight off my shoulder that I didn't have to worry that I was a bad parent. I didn't have to worry that I was doing something wrong, because there were other people there that were there to tell me it's okay. It's okay to use these resources. That's what they're here for. It's for people who need it. It's for anybody who needs it, regardless of what your social status is. If you need help, you need help. And I don't know how I would have fed my son without those resources because nothing else was working. So I'm just thankful that they were available and that I could get them when I needed them. Being able to have somebody that comes and sees you when you're in the hospital, when you're insured or underinsured, and can help you with those resources when you need them. The convenience of it makes people feel safe and secure in their healthcare. Both of my children were born here. Connor was my COVID baby, mid-shutdown. You need those people that you know are going to take care of you, especially during that time. Healthcare was insane in 2020. It was absolutely crazy. You had no idea what things were going to be like or what things were going to be available. And you just needed those people that knew you, that could tell you, like, it's going to be okay. We're here, we're not going anywhere, and we've got you. That was so important to me, especially, and I was a first-time mom. I had no idea what I was doing, and I was allowed one person. I didn't get my mom. I had my nurses who I'd worked with day in and day out, and who knew me and who had been with me through the entire pregnancy and all of my checkups and all of my things that I had to do. I had them. And it made it that much easier for me going through something that I had no idea what I was doing. Connor is 4. He is finishing up preschool. He will be starting kindergarten in the fall. He will be going to the same school that I graduated from. He is actually the 4th generation on my mom's side to graduate from this school. He knows no fear. He knows no bounds. If it's dirt or if it's icky, he's gonna find it and he's gonna be thrilled about it. But he doesn't have anything holding him back. He got through everything. He was able to get that, that specific nutrient that he needed, and he was able to do perfectly fine. If it wasn't for WIC and for Medicaid, there's a lot of things that I wouldn't have been able to do for him. And it wasn't just the formula. It was not having to worry about how I was going to afford medical bills, because we're constantly going to appointments to figure out how to keep nutrition in his body. It's being able to have that peace of mind. I have worked here for 8 years. I've had 2 kids here. I have had family that needed to be here. And to have the rural hospital of it all and the small hospital, it's so important for communities like this, regardless of what insurance you have, whether you have Medicaid or whether you have a private insurance. It's so important for it to just be in your back door, that you don't have to travel hundreds of miles or jump on the highway to get care. You need to be able to just get in the car and say, we're just gonna go. My mom had a heart attack that was caught on an EKG that she was having here. She was hooked to the leads and the tech saw it. They had her life flighted to Borges and saved her life. My daughter, born last year, 2024, was class 2 C-section, so not emergent, but I wasn't going to be able to have natural labor. Wouldn't have caught that if I wouldn't have been able to be here. And again, they work their butts off around the clock to get you where you have to be, whether it's here or whether it's not here. And I'm just thankful for the teams that have taken care of me and my family over the many years. The community and the camaraderie that you have in a rural hospital, it's unmatched. This community will not survive without it. It's the rural community that can't function without a local healthcare center to take care of them. I don't want to drive cross country to get my basic health needs met. I want to be able to go 15 minutes down the road to go to people I know, people who know my health history. I don't want to have to pick all of that up and go somewhere where I'm just a number. Rural healthcare is just as important as big city healthcare. We have to be able to take care of these people.
View our many patient testimonials on our YouTube channel.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.